morning. Welcome to Defining Your Health Talk Show. I'm your host, Dinah Morales. This morning we are going to be discussing a very important topic, elderly health. And this morning we have a very special guest who is an expert in the field, and she's here to share her knowledge with us. Our guest is Miss Ishel Putt. She's a resident of the capital city, Belmopan. Presently, she serves as the Executive Director at the National Council on Aging. She holds a specialization in the management of older person health from the World Health Organization. She's certified in social gerontology by the International Institute on Aging in Selima, Malta. Ishel has worked at the National Council on Aging since 2009 and has developed various programs on aging and health, caregiving, elder abuse, and continues to advocate for the protection of older persons' rights. She has represented Belize on several international panels discussing the advances and challenges faced by older persons. She's a jack of all trades, and apart from her professional life, Miss Ishel is a published author and is the winner of Belize Literary Prize in 2015 and a member for the Belize Book Industry Association. She's an active member of the El Shaddai Seventh-day Adventist Church, where she served as Sabbath School Superintendent and Sabbath School teacher. She has also served in the youth department and enjoys working with church programming that addresses social challenges and positively impacts the community. Good morning, Miss Ishel. We're happy to have you.
Hi, good morning, Miss Dinah. How are you doing?
I am doing well. Elderly health is something that I must say I haven't heard much about. Yes, on the television, we see different ads talking about elder abuse and caregiving for elders. We also notice the senior homes putting up ads of the services that they provide for the elder. But let's talk a little bit about the concept of aging. Can you elaborate a little there? We know there is biological changes and life transitions associated with aging. Can you further explain on this concept?
Right. Well, aging is a lifelong process. Everybody likes to think about aging as taking place when we see our very first white hair or when we start slowing down. But aging actually takes place at the inception, at birth. A baby is born, and the following day, the baby is a day older. So aging is a lifelong process. The United Nations defines an older person as anybody who is 60 or older, which is the age that we use here. But that age is really used to look at changes in health, which is something that you mentioned earlier. As we age, our health changes. So there are normal changes associated with health, and these are the generalized changes that takes place in our bodies, regardless of our health status. So we can all expect to eventually have to wear eyeglasses, for example. That happens around age 40 when our vision begins to change. Our ability to hear also changes. So we need to adjust volumes. Things need to be a little bit louder. That is also a normal part of aging. Our taste changes, and that's one that we don't pay a lot of attention to, but our tongues detect taste differently as we become older. Of course, we move slower. Of course, there's changes in our skin. You can see the wrinkles, gray hairs appear, and those are all normal biological parts of the aging process. And those are most notably when a person becomes 60. So we look at those changes there. When we also talk about the 60 demarcation in age, or that cutoff point or that identifier point, you're also looking at how the body is able to recover after a person becomes sick. At 60, our ability to heal ourselves changes drastically. And so we need different types of health interventions, different types of health screenings, different types of activities to be able to maintain good health. It's also important to note that further into aging, there are also other brackets that we talk about. So 60 to about 65 is what they would call the young old. This is an older person who is still active, still able to cook for themselves, who drives, who doesn't look their age for the most part, or what we would term to be someone who is older. And then you have 65 to 75, which would be the middle old. And these are people who are visibly slowing down. They're not able to lift heavy things as before. If they become sick, it takes a little bit longer for them to get better. And then you have 75 and older, which is considered the old. And that's because at the age of 75, right around 75, when an older person has a health episode. So they might fall, break a hip, they might have the flu, they might be experiencing challenges with a chronic condition, which can be diabetes or hypertension. Any of the complications after the age of 75 becomes even more serious and life-threatening because the older person enters into what they call a state of frailty. And that's one of the reasons why, from a health perspective, they demarcate age, or they identify a patient according to age, because the health interventions changes as we become older. But the concept of aging really depends on where you are in the world. For example, here in Belize, we are what's considered a relatively young country because we have more young people than we have older people. And we also find that here we don't have as many older people who are living into their 90s or into their hundreds. So if you would be in, say, Japan, and you're 60, you're not considered old because they have one of the highest rates of centenarians. So it's not until you're about 90 they're going to think that you're old. If you are in Africa, in one of the areas that have been hard hit with HIV and AIDS, is the persons who are in their 40s, 45, nearing 50, those are the people who are considered to be old because they are the oldest members of their society. So the concept of aging really shifts a lot depending on where you are and how you are aging biologically.
Okay. I noticed you mentioned some of the health condition just a while ago that affects the elderly. Can you elaborate a little, or probably list them so that those of our viewers that are watching at home can be alert of these conditions? And also, can you talk a little bit on how loved ones and caregivers can accommodate the needs of the elderly?
Okay, so when we talk about health conditions that affect older people, the most important thing that I would like listeners to realize, and one of the points that we kind of emphasize when we are working with groups, mostly with younger people, is that when we become older, you cash in all the checks that you wrote in your youth. So when we say that older people have chronic conditions, and those are conditions that can be managed but not necessarily healed or overcome, or they have non-communicable diseases, and these are health status diseases such as diabetes or hypertension. And these are diseases that you can't give to someone else. So they are yours, and those are things that happen because of choices that we made when we were younger. They're called lifestyle diseases. So those are avoidable, they're manageable, but they manifest themselves later on in life because at that juncture in our health, our body starts responding differently to sugar, to stress, to lack of exercise. As your body becomes older, it is unable to absorb what I'm going to term as the abuse that we put on it. And so these other things manifest themselves as health challenges. And then, of course, you have health challenges that are associated with arthritis. You also have forms of dementia, which I know is something that people think a lot about when we become older. People often are afraid to grow older because they are afraid that they will become senile, they will have dementia, they will develop Alzheimer's. But in actual fact, that is a stereotype that has been portrayed because it's one of the concepts that we hold closer to aging. It's about it's about 6 in about every 100 older persons who might end up with a type of dementia, and there are several different types. So it's not normal. There are normal changes to your memory as we age, but it's not normal that you will become that you will develop dementia or develop senility. Those are not normal parts of aging. And very often we find that older people who develop those kinds of sicknesses have had trauma. It might be hereditary, or they have been in cases of isolation, and so they have lacked the mental stimulation to maintain good brain health. So those are some of the things that definitely affects older persons. Something that we don't talk about very often with older people is that they are impacted by depression, anxiety, and loneliness. And these come in because of the transitions and the changes that happen in life. And these diseases will manifest themselves differently in an older person in some cases. So you might find an older person who no longer wants to shower, no longer wants to eat, and physically there is nothing wrong with that older person. But he or she might be experiencing a form of depression because they have experienced a recent loss. And it's a very interesting concept because as we grow older and the older we become, the more close relationships we tend to lose. So a great example of this is my grandfather passed away when he was about 92. And my aunt made an interesting comment that there was only one person in his village that could refer to him as boy. So there was only one person left from his generation. There was only one person left who knew his identity outside of being my grandfather, outside of being a father. And so having only one connector to your past is oftentimes a source of depression because you're looking around that life has continuously changed and all the things that you have lost. So that's something that isn't very often talked about or explored with older persons. Another important health issue that faces older people is to look at their ability to balance, to remain upright, and to move. Falls prevention is a huge issue in older persons' health, and this impacts the way furniture is laid out in a house, the availability of grab bars in places such as bathrooms, showers, in public places, because an older person who falls and experiences a break in their hip or any general part of their body, their life expectancy is greatly impacted by that fall and the treatment that they receive after that fall. So those are some of the challenges that you can see impacts older people or people in general as we age.
I noticed you spoke a little about lifestyle diseases, and as you were talking there, it got me thinking that in order for you to have a in order for you to be a healthy elder, you need to start making those changes from your being a youth.
Oh, yes.
In order for you to,
Definitely.
at least age without having all these associated health conditions that you mentioned. I remember when my grandmother died, she died at the age of 67. And, because she was our grandmother, we thought, old age, that's why she died. But then as I grew up, I realized that dying at age 67 is young. Because I see so many older ladies who are living into their 70s, their 80s. We have one of our patron, you would say, at Ladyville Sinai, Miss Bennett, who is, much older than the age at which my grandmother died. And I remember my grandmother had diabetes, and sadly she got stroke twice while she was in the hospital, and she later passed. She used to always tell us, make sure you eat good. He said, because when I was younger, I didn't eat well, and now I'm paying for it. And I'm sitting here and listening to what you're saying, it's evidently true that whatever we do at a younger age affects us later on in life. Can you go ahead and give some of the factors that influence healthy aging, and also share how the society can assist the elder in experiencing this healthy aging?
Well, two of the main things that impact the way we age are hereditary. What are the things that we are already hardwired for when we are born? And then, of course, the environment that we live in. So those are two things that we have to look at. Like, for example, you mentioned that your grandmother was diabetic, which means that your likelihood of developing diabetes is higher than the average person who doesn't have a diabetic family member within their direct connection. So in my case, mine is even higher. My maternal grandmother was diabetic, and on my father's side, I have about two grandaunts who are diabetic. I have some uncles who are diabetic. So that means that that gene already exists in my family. So I need to be careful and make important decisions in regards to my health as to how I am going to mitigate my risk of becoming diabetic. So you have to look at those hereditary factors as well. Unfortunately, one of the things that we do know is that older people who develop some form of dementia, that can also be hereditary. So there are things that you can do as a younger person if you realize that you have propensity to become depressed if you're not managing stress well, if you're not sleeping well. So it's investing your time into your brain health is also very important for aging process. And then, of course, the environment in which we age. And when we talk about environment, we're talking about your home setting, what happens to the older person as they become older, and also their community setting. Where are they attached to their community? Because that's one of the most important parts of the aging process, being able to remain attached to your community, not becoming isolated, not becoming disenfranchised, not losing where you stand in your community. So within the environmental setting of a home, when a person becomes older, where are they living? Are they able to come outside and walk around the yard? Are they able to carry out the what we call the activities of daily living, which is their basic? Can they take a shower for themselves? If they can't, what is the reason? Is it because that they can't step into the tub that is in the house? If they're unable to come outside, is it because the house is a two-story house and they need to manage stairs, so that limits their ability to come out? And then, of course, the community and the environment in which we are living in. Are they accessible? Are they able to go to stores in order to purchase healthy food? Are they able to meet and interact with their friends? Are they close to their place of worship? Where are the things that are most important for them? Sometimes we want to think that, there's a secret to aging well, or there is a formula that we have to plug in when we hit at 55 so that when we jump to 60, we maintain health. But it's not really that. It's ensuring that all the things that we need in our younger life or in earlier in our life still in place for us as we become older. And that has been one of the main challenges that has surfaced with the COVID-19 pandemic, maintaining physical distance but not social distance, because we find that it is in the social activity that older persons are able to maintain their health and keep their own well-being. There is also the misconception when we think about health and older people is that an older person needs someone to physically take care of them. And that is a challenge that we do face because it takes away the autonomy of the older person. It takes away portions of their choice. So, for example, and I know my mother won't mind because I've done this to her several times before. My mom is in her 70s, right? She doesn't have any communicable diseases, so no hypertension, no diabetes. She's very active. There's certain things that she's had to slow down to do, but it is in allowing her to carry out her day according to what she wants to do that allows her to continue to age well. Sometimes when a person hits 75, you're going to hear things like, "What you want to go to shop for? You got no business to go to shop." But what is the issue with someone being 75 and wanting to go to the store, 75 and wanting to go to a park, being 80 and want to visit friends? We kind of think that at a certain age, you need to sit on a veranda and rock in a rocking chair, listen to the good old songs, and not have any interest in other things. But this is not how we age, because the things that we like in our younger days don't disappear when we become older. We're just told that
Right.
they're not appropriate because we're older. So one of the major health activities that the council did run is a Senior Steps Dancing for Health Club. There was a branch in Belmopan and one in Corozal. Because of the pandemic, they're not meeting right now. But we have older people who, in their 70s, 90s, they show up to dance and exercise. And 30 minutes worth of exercise in 1 week improves balance, helps to maintain blood sugar levels, pressure levels, helps to deal with anxiety and stress. Some of the older ladies no longer use their walking sticks at the end of the 6 month pilot because they had regained strength. And what is the difference in that program? Really, just that you give older people an opportunity to do something that they love and be active. And those are the important parts of aging, or that's how you look at changing environments for health. How do you maintain that this older person can be active, happy in doing what they're doing, and engaged in the world around them? And you see the entire process change. Now, it is challenging in Belize because what we find for the most part is that aging here is very linked. I shouldn't say very, is linked directly to cases of poverty. And that is because we don't have the necessary social protection systems in place that really provide for financial security for older people. We did a study in 2010 which showed that 61% of all Belizeans have no access to a pension. So while people are becoming older, they are still very much preoccupied with how are they going to survive. And that in itself brings its own stressors that creates problems in maintaining a healthy diet. And I'm sure that we have seen this in our community. You would see an older man out there pushing a cart selling vegetables. You would see a couple who has a little store in their house that you probably know doesn't make a lot of money, but they're selling soft drinks and chips and biscuits and these kinds of things. And that is in an attempt to ensure that their livelihood is secure and they're going to be able to survive. And there's also the high cost of medical care and intervention, and that really impacts the health of older people. The National Health Insurance Program hasn't been rolled out throughout the country. So you find that there are still pockets where older people still have to pay for medical attention, still have to pay for their medication. And this in itself becomes a huge challenge in being able to maintain health.
Right. Okay, well said. At this moment, we're going to take a quick break and we'll be right back.
According to the Center for Disease Control, men die on average 5 years earlier than women. While women are expected to live an average of 81 years at birth, men are expected to live an average of 76 years, with non-Hispanic blacks having the lowest life expectancy at nearly 71 years compared to white and Hispanic males. That's a fact, but there's hope. One of the factors contributing to worse health in men is the higher prevalence of cigarette smoking among males than among females at any age. By quitting the habit, males can reduce their chances of dying from any cause and experience a longer and happier life. So don't delay, quit today.
A study published in the Journal of the American Dietetic Association found that toddlers aged 12 months and older consumed a third of their daily calories from snacking between meals, with the snacks becoming less nutritious as the children got older. Dietary patterns low in fruits and veggies and high in sweets and saturated fats began to develop between the ages of 12 months and 24 months, and this pattern tended to be established by 24 months. That's a fact. But there's hope. Parents can establish the foundation for a healthy diet early in life when eating habits and preferences are being formed. Simple dietary changes, such as offering more nutritious snacks, can help prevent obesity and chronic disease in our children. So switch the gummy bear for blueberries and see them growing healthier and happier.
Abigail.
Yes, Gran?
Abigail, I can't breathe well.
Granny, we need to go to the hospital to get you checked out.
No! I'm fine.
Yes, Gran, we need to go now to get you treated. Now, before it's too late.
No.
Grandma, we need to go for all of us.
No.
Stop.
If you are having flu-like symptoms, please call us immediately for medical guidance. If you have chronic conditions such as diabetes, and you're experiencing symptoms such as shortness of breath or chest pain, please also seek medical attention immediately. We lost a lot of people this year. We don't want to lose you too. Please seek help if necessary. Call us at 0800-664-2273. Continue to wear your mask at all times. Keep physical distance when in public and stay at home unless absolutely necessary. This message has been brought to you by the Ministry of Health and Wellness.
Welcome back to Defining Your Health Talk Show. Today we have Miss Ishel Putt in our midst. She's been here talking about elderly health. So far, we have discussed the concept of aging. We've also discussed different health conditions that the elderly face and how the society can assist in helping the elders to reach healthy aging. Ms. Ishel, I want to divert a little bit. I want us to talk about population aging. Can you share with us what is population aging, and also can you give some of the challenges that have arisen when responding to population aging?
Okay, so population aging is a concept that looks at the aging within populations quite simply. We see it greatly in Europe, for example, where we have a lower birth rate. So there are less children being born and people are living longer. And so that population ages. In Latin America and the Caribbean, we have the highest rate of population aging in the world, which means that every year our percentage of older persons grows significantly in comparison with other areas in the world. In Belize, our growth is approximately 1,200 older persons become 60 and older every year. And so what that means for a society like ours, where our birth rate has maintained a steady level. So in Belize, the average birth rate, I believe, is about 3 children for every 1 woman, which is still very high in comparison to other places in the world. So when we look at small children being born and having children, adolescents, youths, and then a rapidly growing population of older persons, the challenge then becomes, how do our social systems and health systems address both of these at the same time? In other countries where they have seen a decline in the birth rate and an increase in their older persons, what they've done is they have realigned expenditures. So, for example, in some countries, they have closed primary schools because in those districts, there are no longer enough children to maintain the population of a school. And that idea seems crazy here in Belize, where we are constantly opening more schools because we have more children. But in creating those shifts in their systems, they're able to allocate finances towards maybe housing for older persons, health for older people, community caregiving for older people. So they're able to divert resources but in a system where you still have a high percentage of young people or small children, then you're having a high percentage of older persons, you're going to have to try and find a balance. How do we care for both these populations who need resources at the same time, ensuring that we are maintaining their health and well-being? And that's one of the major challenges that we do face with population aging. And then, of course, the shift in family dynamics. Most of us know that society has changed in that more women in the workplace means that there are less women fulfilling the traditional roles of caregivers, which means the idea of caring for an older person then changes drastically. The idea of child care also changes. And so looking at how those things impact the population as we grow older. So where in before, persons would say, oh, my daughter is going to take care of me when I am older, but now your daughter is fully employed, has a family of her own. She might have not had children until later in her 30s or right around her 30s. So at the same point in time when you are older and needing care, she's also providing care for younger children. So that burden of care becomes great. And then coupled with an older person having limited financial resources to be able to hire or employ a caregiver, that also creates a challenge in maintaining livelihood and health. And then, of course, we look at challenges that occur with residential facilities. Many older people reach a point where they might not need around-the-clock care, but they're unable to live independently for varying reasons. Might have challenges cooking. They might have slowed down. It's no longer safe for them to be in a home by themselves to take a bath if something happens. And then here in Belize, we have challenges with being able to access residential care because the care is limited and it is expensive. It is expensive. Some older people have available for them somewhere between $40 and $100 a month. I mean, that is their income that they are certain is going to come in. And the most affordable residential facilities start at about $350 a month for you to be able to stay there. So the challenge of being placed in a residential facility, if, as an older person, I can afford to do it, or as the family of an older person, if we can afford to do it, those are all challenges that arise when we talk about population aging. So you're looking at where these older persons are placed in our country, in our populace, and how they are able to maintain life, health, dignity as they age. So those are real challenges, real challenges that are faced that don't have one answer. And I think that's one of the most important things when we talk about aging, because everybody always thinks, it's one answer to fix this problem or address this problem, but it's not one answer. It's several little things put in place. So it's increasing pensions or access to pensions. It's improving access to healthcare services. It is strengthening and improving networks of service providers and older persons organizations. All of those things play key roles in ensuring that we are able to meet the challenges that are being faced or that are emerging as a result of population aging.
Based on your bio, we know that you attain a specialization in the management of older person health from the World Health Organization. Can you share what have been the World Health Organization response to elderly health? I know you mentioned just now about increasing the pensions. Can you say what the World Health is doing to address at least some of the things that you listed before?
Well, the World Health Organization wouldn't address pensions. That would fall under a bracket of social protection and social security, which is completely different. The World Health Organization, as with all other organizations attached to the United Nations. So within the scope of the United Nations, there is a focal point for aging. And that focal point then has emerging programs that address various areas within the dynamics of aging. So within the scope of the World Health Organization, you would be looking at addressing the health needs So it's different. So you have the health needs when you become older, and then you have the social needs when you become older. They are connected, but they are different. So the World Health Organization has piloted what they call the active aging policy, which takes on a life course approach. And when we talk about a life course approach, we talk about putting in interventions from early on in life, just like we were talking about in the beginning, of how you, at the age of 18, 19, 20, at the age of 10, 11, 12, can be taught to make healthy choices so that when you reach 60, you have a higher chance of leading a healthy, independent life. So that's part of what the active aging policy does. The active aging policy also seeks to create opportunities for older persons to improve their health, and that is through expanding health systems and health coverages, running programs that improve health, and also supporting caregivers. One of the important parts is to note that in order to have a healthy older person, we need to have healthy caregivers. And that is being able to provide caregivers with the resources, the tools, the knowledge in how to be able to provide care with avoiding being burnt out. And then you will have other areas within the scope of the United Nations that will look at things like legislation that protects older persons. So for example, in Belize, we have no legislation that protects older persons. And sometimes people think, oh, well, why you need a law to protect old people? But the truth is, because there are no legislations that protect older persons, there are challenges that arise with aging. So for example, one thing is, in order to report a case of abuse, a person has to physically report and agree that this is what is happening to them. You can't have an older person who is facing dementia, who has been intimidated, be able to do that for themselves. So within the legal framework, we have to be able to set up that there are proxies and people who are able to speak out on behalf of these older persons. At the Council on Aging, that is not our role. So while we are able to network and move older persons through social systems in order to get them the support and protection that they need, we are unable to provide it. So I can take an older person to a police station. We can see that the older person is being abused. But unless the older person wants to make a report, there is nothing anyone can legally do right now within our legal framework. So those are challenges that need to be addressed where we talk about legal framework. And then there are also cases where older people might have been the victims of disingenuous business people, disingenuous family members, Come, Grumps. Come on, just sign over the house. I will mind you till you're dead. They sign over the house, and then they are left practically abandoned, and there is no recourse because the document they have signed is legal. And so the challenges of being to mitigate that kind of thing can only be done through change in legislation and creation of laws that protect us as we age, recognizing that our social situation as we become older changes is in and of itself. So those are things that we have to look at. And there are also the World Health Organization, PAHO, the Aging Networks, and the International Institute on Aging. They've all been working towards laws throughout Central America, population aging conferences, movements towards getting involved with governments and supporting the drafting of legislation. So for example, PAHO Washington had in 2009 supported the drafting of legislation here in Belize regarding older persons and legal actions. The legislative process is unfortunately a lengthy one, so it's the one that we are still involved in. And then also PAHO Belize has been one of the agencies that has supported through allocation of resources, bringing in technical experts to meet with government to talk about protecting and safeguarding the rights of older persons. Because there is a convention on the rights of older persons. And sometimes in general conversation, when we talk about conventions, people think that they are just documents. Oh, there's a convention on the rights of a child. No, there's a convention about women. No. But what happens with a convention in a very simplified way is that if a government signs on, ratifies, agrees to abide by a convention, then that government becomes responsible and can be held internationally accountable for what they have signed on to do. So signing on to a rights of older persons means that a government would then be accountable to a larger framework at the United Nations to be putting into place legislation to protect the rights of older persons, to be able to provide housing, affordable housing for older persons, to be able to provide mechanisms that effectively and directly address elder abuse. So while the documents in and of themselves might seem abstract, and a lot of times we might think that, oh, these things are not practical, they serve a very practical purpose if we have the support behind it, having force to ensure that what is said is actually done.
Right.
So I hope that gives you kind of like it's a very basic framework of how some of those things work.
Yes, indeed, it did clarify the differences between the two. I noticed something here. You mentioned that, well, I would have asked you what are some ways as a country we are lacking in terms of providing the help that the elders need, and you already mentioned some of those. I noticed you said there's no legislation in place right now as we speak. Therefore, when things such as elderly abuse occur, if the person is not willing to make that formal report to the police, there's nothing done. So my question here, until this legislation becomes enforced or before it's signed up and whatever, what are the steps that you guys are taking in order to deal with these? Because I know these things are happening on a daily basis. We may not see it because it's like you said, it's not being reported. It's hard to report, especially if the elder persons are not in the position to do that. But I know they're happening because, some time back I saw video on, for social media. Now everything gets placed there. And there's a video circulating with an individual who was seen doing elder abuse to an older person. When you guys have situation as such, and it's not only elder abuse in that sense, like you mentioned, when people of trust, where they take away the money from them, whatever. Sometimes you have some of the people who go and get the money from their bank accounts. There's a lot of different ways in which these elders are being abused. But if these stuff are happening now as a organization, what can you guys do with the limitations that you have?
Okay, so I think one of the difficult things to understand with the scope and the mandate of the work at the National Council on Aging is that we do not have the mandate to respond to cases of elder abuse. The council is staffed by 2 persons, so we also lack the resources and the network to be able to adequately respond to cases of elder abuse. In the case of any form of abuse, any form, whether it is elder abuse, child abuse, abuse against women, abuse against men, any form of abuse, those cases are referred to and resolved by the Ministry of Human Development through the Human Services Office in conjunction with the police department. And so a lot of times people think that, because it's elder abuse, it's something completely different and we don't know where to go. When in actual fact, there are only 2 places you can go. You can go to the police department and you can go to the women's department. And so what happens? If it is a case of suspected abuse, the police will make an initial intervention if they're called in. We will refer a social worker, and then the follow-up work ensues. And you have to find how you will continuously monitor that situation. If it is in a case, like for example, the one that you mentioned regarding the video. So what happens then is yesterday there was an intermediary session and a plan was outlined, and all the steps are being put into place to remove the older man from that situation permanently, and then to ensure and provide the support for his new environment that this will not occur. So what are some of the challenges that we do face? There are no respite institutions. There are no facilities or foster homes for older people. So, for example, you find a child in an abusive situation, there is a legal framework that you can remove that child without that child being able to make a referral for themselves. You can remove that child and place them within a foster care system. It doesn't work the same way for an older person. There are no foster care systems for them. And presently, we have three main facilities that operate: Golden Haven in Hattieville, which is run completely by the government; Sister Cecilia's Home in Belize City, which is the government and healthy age; Octavia Waite Center, which is the government and healthy age. So those are three main facilities that are the most accessible. And then you have My Cielo Blue, and Birdfoot Gardens, which are also residential facilities. They are completely independent residential facilities. So that means they get no support from government, and their fees are considerably higher because of the cost of care. So unless there is a place within these three facilities where an older person can be placed, and I can tell you that most of them have waiting lists, because within these three facilities there are less than 100 beds. There is limited ability to physically move an older person immediately from where they are. And that is a very big challenge. It's a very big challenge. And so the system in itself needs to be strengthened with several mechanisms. Where is the respite care? How do you move them? Where does the medical care come involved, the intervention with the family, and what are the wishes of the older person? Many times people want to say, oh, you just pick up and move on. You have to move on. But sometimes upheaving their life, moving them, even if it is an abusive environment, you don't want to leave them in that environment, but you don't want to remove them completely from their community as well. Because when you remove them completely from their community, you're removing them from their friends, you're removing them from everything that they have around them that they can recognize. And so the process is difficult. One of the things that we have been trying to define for a while is what are the exact steps and where are the resources. Fortunately, as time goes by, there are more organizations on the ground. There are more places that have the ability to reach out and provide support. So even if you are not able to move an older person immediately, there are organizations such as HelpAge, Life, Hope in Punta Gorda, the Mercy Care Clinic through their social worker. And what happens is when the cases are reported, they begin monitoring, visiting, meeting, empowering the older person and providing the resources that they need so that the next steps can be followed. It is not a perfect process. It is not an ideal process. And it is unfortunately the process that we have to work with right now until we are able to move things along in a more coordinated effort.
I noticed, Ms. Scott, that you mentioned several different senior care homes, and you mentioned those that are supported by the government and the others that are private. For the ones that are private, is there any monitoring being done by any of the organizations regarding aging? Like, come in and they see the facility, care that is being given. Is the staff that attends to these elders on a daily basis, are they trained, or is just something that the private senior homes, they are run independently and there's no monitoring from the official organizations?
And that's an interesting question. Unfortunately, as most things with aging, there is no regulations for residential facilities. The facilities that we do have operating right now have, for the most part, been very compliant with the government structure. We at the National Council on Aging have visited all of them. They have all, to date, ensured that their caregivers are trained and certified. The council, in conjunction with BTEC, runs caregiver training on different cycles. And also the Red Cross runs caregivers on different cycles. So there has been a very conscious effort to ensure that caregivers employed within a residential setting, and even caregivers that are now being employed in the community, have been trained and and have the necessary skill to provide care. In regards to the homes themselves, there is an inspector of homes attached to the Ministry of Human Development, and that is their role to inspect and ensure that homes are up to standard, are running, that there are no incidences of abuse. And then within the facilities themselves, there is a referral process where they can, if they suspect that there is a case of elder abuse by an employee within the facility, they can make their own referrals to address those cases.
For those who are taking care of their loved ones at home, what are some advice that you would give that will assist them in giving the best care to their elders so that they can age in a healthy way?
Okay, so one of the most important, I keep saying most important thing, but when we look at caregiving, caregiving is a difficult task. And I think that is something that is very important for us to acknowledge, that caregiving is difficult. It's not easy. Sometimes people think, oh, it's my responsibility. I have to care for my mother. I have to care for my aunt. I have to care for my father. And you take on the responsibility, but it is difficult. And oftentimes it is a long commitment. So, for example, the average life expectancy right now in Belize is right around 76. So, if you decide at 65 you are going to take in an elderly family member, or an elderly parent moves in with you and they are 65, you can anticipate that this person will be in your care for the next 11 years. So we don't think about it like that initially, but what can 11 years of care look like? It can look like an older person moving from being able to take a bath for themselves, going to the bathroom for themselves, to being someone who needs you to take a bath, to you having to purchase and change pampers. It can mean you going from cooking one general meal for the entire family to having to prepare separate meals for the older person because they're no longer able to eat the kinds of meals that everybody else eats. So the cycle of care can become very overwhelming. And so for family members, for people who are caring for older persons at home, what you need to have is you need to have a network of support. You have to recognize that the caregiving process isn't one that you can do on your own. So there is no shame in accepting help. And sometimes that also is a challenge. You ask for help, you feel like you might be failing as a caregiver, but we all need help at some point in time. So having a network, whether it is friends or family, having somebody who, if your older person needs a lot of care, someone who you can call on a day and say, girl, I don't got no time to cook today. And that person will be able to tell you, oh, no worry, I got you, and drop off some food for you. Or if there is an emergency and you need to leave the older person in your care, someone who can come and sit with that older person. Or if the older person likes to, say, go to church on a Wednesday night and you are unable to go to church every Wednesday night, who in your congregation is somebody that you can call, who can pick up your older person and take them to church and bring them back? So that is not something that you are struggling with. And then, of course, learning as much as you can about the older people in our care. It has also been one of my experiences is that we relate to people only in the place that we meet them. So we don't think about the fact that the older person we might be caring for, who they might have been in their younger years. What are the things that they might have been interested in? What are the things they might have accomplished? What are the things that give them a sense of purpose and self? And so you only want to treat them in this chapter of their life where you met them. But if you have conversations, you talk, what are the things you like to do? The music you like to listen to, the food you like to eat. Why did you decide to become a nurse? How did you end up becoming a mechanic? You learn all of these information. then you are able to provide for them a place of belonging and being. You're able to know more about their story. And very often it helps you to understand how to provide the care the older person needs. As a caregiver, it is also important that you make time for yourself. You cannot give what you do not have. So if you are tired, if you are burnt out, if you are stressed out, that is the kind of care that you will provide, and that's why it's important to have that network. And it's also important to be able to reach out and ask for information. Sometimes we are ashamed to ask for information because we are worried about stigma or failing, and that is a challenge that we see a lot with caregivers, especially who are caring for older parents who feel like they should know or they don't want others to know what they might be going through. If your older person has started to become incontinent, which means that they might be bedwetting, they might be wetting themselves, they might not be able to control their bladder as before, but you don't want to talk to anybody about it. So you start to limit what the older person is able to do. The person becomes withdrawn and sad. You become stressed. But if you reach out to a nurse, to someone who might have cared for an elderly patient before, what are some of the tips? What are some of the things that they have used that you can take and use for yourself? So there's always value in being able to have other people around you as you go through your care journey. And those are, some of the things that I think sometimes caregivers miss. We become caught up with being able to carry out what we call activities of caregiving or what we think to be the most important parts without caring for ourselves and ensuring that the older person in our care has maintained their humanness and as much of their independence as they can.
Hell, I like what you said there about seeking the help that you need. I know a lot of times, especially if you're the child of the elderly, you are going to say, well, it's my responsibility. I shouldn't be asking the one for help. I'm the one that's supposed to do it. I know of a couple that they have the wife has her dad living with her, and sometimes as a couple you want your me time, you want to go on a date or something, but oftentimes those are put away because they have her dad there and she wants to ensure that her dad get the best care she can. And while that is admirable, she also needs to realize that she has other relationships like the one with her husband that she also needs to pay attention to. So I like what you said, that we need to, even if we find it hard sometimes, we need to seek the help that is going to assist us in caring for the elderly. I remembered one time on Ladeville Highlights, they had this elderly man who needed so much things. He needed food, he needed medication, he needed some of the stuff that he needed to put for him to use the bathroom. And I remember the page manager for Ladeville Highlights put it on the Facebook, and one by one you see the outpour of love from the community, even from those abroad, that all the needs that he had, one by one together, they were able to complete all the stuff and give it. And he was very, very grateful for having that. So we should never be, how you would say, as you mentioned, shy or, don't want to reach out for help. We need to do the best we can, caring for our elder without being burnout ourselves. Ms. Ishel, we want to thank you so much for being with us. I must say, I learned a lot today. As I had mentioned earlier, I didn't know much about the elderly health, but you have opened my eyes to so much things, and now I can share this with my loved ones, with my friends, and those that I come in contact with. We want to also thank our viewers for watching at home. We invite you to tune in again for another edition of Defining Your Health.